Hi, I'm Mike Settas. I'm here today to talk about the release of the Medical Schemes Amendment Bill and the NHI Bill. These two fairly important pieces of legislation are looking at enhancing healthcare cover in South Africa. They have really looked at how NHI will be implemented and how the medical schemes will operate in parallel with the NHI. But one of the discussion points that we wanted to look at today was how this ties in with the primary care exemption, or what is known as the LCBO exemption that's been given to insurance companies to carry on operating as doing the business of medical scheme, even though they're not registered as medical schemes, and how this ties together with these two bills. So what we've looked at in reviewing the bills is that neither the Medical Schemes Amendment Bill nor the NHI Bill actually covers anything to do with LCBO itself. It's not explicitly mentioned, so we raised some questions as to whether or not the LCBO will just run under the exemption that it currently is on, or whether it will actually be introduced at some stage by the medical schemes regulator or be made part of either the NHI Bill or the Medical Schemes Amendment Bill. So there's quite a bit of uncertainty at this point in time on LCBO, and really what we're looking at today is to explore that in some detail, or as much as we possibly can without really knowing too much. And sort of see if insurers will still have a part to play in going forward on providing these primary care benefits that are not part of the medical scheme world currently. Okay, so at this point in time, without any explicit provision for LCBO within the Medical Schemes Amendment Bill or within the NHI Bill, we believe that the options available to the council are either to allow LCBO to exist in medical schemes in future by way of the exemption provision contained in Section 8A of the Act, 8H of the Act, or possibly just to extend the exemption period that insurers currently have and allow them to still continue with these two products. So just to wrap up in terms of our thoughts around that, the two bills, the NHI Bill and the Medical Schemes Amendment Bill, doesn't really give us much in the way of clarity on where the products in the exemption framework or the LCBO will go. But those two options are really the sort of two options we could think of, either under that exemption process under 8H within the Medical Schemes Act, or the Council for Medical Schemes will extend the exemption for another 2 years beyond the current exemption framework, which ends in April next year, 2019. That's about the thoughts we could have on it at this stage. Thank you very much.